Hello everyone, my name is Maryam Al-Mansur. I'm the founder of Arewa Cafeteria. I decided to make this video because I want to throw more light on what Arewa Cafeteria is all about, the kind of activities that we do, and how we're going to impact on the lives of women and children in Nigeria. I want to start by saying that our Arewa Cafeteria is not a physical restaurant, as a lot of people have been asking us where are we located, what kind of foods do we make, how much do we sell our plate of food, and so on. It is not a physical cafeteria. I created that initiative because I want to support the nutrition of women and children in the country. And I thought that with that platform, I'll be able to put in my own contribution and create an impact. So the objective really of creating Arewa Cafeteria is for nutrition education and health promotion. So basically what we do is to source for nutritional information that are credible based on scientific evidence and share with people such that it will influence healthy eating behavior. We also empower women with skills in terms of planning and preparing healthy recipes, and then giving them tips on how to make healthy cooking a very pleasant experience, as well as to alleviate, the kind of pain that a lot of people perceive that they have when it comes to healthy cooking. So if you look at the trends in nutrition in Nigeria, you would see that at the moment we have burden of malnutrition, dual burden. What I mean is that we have both undernutrition and overnutrition. So on the one hand, a segment of the population is battling with chronic diseases like hypertension, like diabetes, obesity, and overweight. On the other hand, you have another segment of the population suffering malnutrition. And malnutrition is particularly much more of a problem in the northern part of the country, especially in the humanitarian crisis zone, which is the northeastern part. So basically what we do on Arewa Cafeteria is to approach nutrition education in 2 or 3 different ways. We have a website where we share information, we share recipes, we give tips, and this is meant to target women who have access to the internet, who are conversant and well educated enough to digest the information that we pass across. So the way we package the information is in such a way that such group of women can benefit from what we deliver online. Then the other component is the offline or live or community-based approach. And here we interact with women, especially in rural areas, who do not have access to internet and who do not have the high literacy level that is required to digest the kind of information that is passed online. So we come to them directly with messages that would make meaning to them, rather than expect that they would have the privilege or opportunity of accessing that information online. And so basically, Arewa Cafeteria is pretty young. This is just our 1 year. This month is 1 year. We started last year, January, and it's still growing. We're still a baby, so we are really trying to get our feet on the ground, and it's a gradual process. So we keep improving every day. We keep reaching out. We keep touching lives. What informed decision for us to focus on the communities, that is the community aspect of the Arewa Cafeteria initiative? What informed the decision for us to focus in the northern part of the country is based on evidence. Our national surveys and other research conducted in the country have shown that lack of maternal education, that is education of women and young girls, has a direct, strong association between how the level of education that they have and their health outcomes. So with that, and with the high maternal mortality, with the high cases of malnutrition that we have, even in the population, not just in the crisis zone, we feel that we should target our community interventions in the northern part of the country. But really, Arewa Cafeteria is for every woman, because when you go to the website, the kind of information that we give, even men, everybody actually benefits. And the scope is really large. We have even gone beyond Nigeria. Most of our views that we analyze from the website, we have people, viewing our website from the US, from the UK, from Canada, from South Africa, all over. So it's really a global brand, but with local touch. So we have on our one of the social media that we have, which is a Facebook. We have a group there for women who have the opportunity to be on Facebook. We have created a group there where they can actually interact with other women like themselves, share information, share tips, encourage each other, and throw challenging questions to us, and then we'll be able to feel, the kind of first of all, the understanding that they have about healthy nutrition and the challenges that they face in providing healthy foods to their families. So it's a very interesting group. It's just starting, and it's growing in number every day. The number of members, joining the group is increasing every day, and we're happy about that. So we encourage women to actually join that group and relate with other women and get to know what is really happening in real life in terms of healthy eating. Because sometimes what you read about might not be the real thing. You would hear the practicalities of healthy eating when other women share their stories. Because I must confess, it's not as easy as people think. Healthy eating is a proactive, it's a very active activity. You have to go out of your way to think about what you eat, plan it, to get it, to process it in such a way that you get the maximum benefit of the nutrients out of the food that you take. So it takes a little bit of effort, but I know that with the kind of tips that we provide, it will really make healthy cooking very convenient, inexpensive, easy, and fun to do. So when you visit the website, like I said, it's still like work in progress, but I know that you might catch a glimpse of what we do there and get some benefit here and there on the different aspects of the website. We have the nutrition component where we talk about general issues around nutrition. We have the health tips component, the page where we give like tips on how to either preserve your food, get the best food, and so on. We have the recipe section where we've posted some recipes there just to motivate you and inspire you to make your own healthy recipes, or actually probably cook what we have presented. We also have the contact page where if you want to reach out to us, you want to partner with us, you can do that through that page. The contact information is there. So I hope I've been able to make people understand what Arewa Cafeteria is about, and what we do, and where we're going. Talking about where we're going, we are planning to have live events this year in different states, especially in northern part of the country. So watch out as we visit each state and meet with women directly, interact with them, ask them questions, let them also ask us questions, and we'll get to know the kind of challenges that they face. For us, Arewa Cafeteria is not trying to do everything, but because you know that nutrition is a very complex and multi-sectoral issue. So we looking at for example, UNICEF conceptual framework of causes of malnutrition. You have the basic causes where you have political issues, access to food and all that. You have the cultural factors and all that. I mean, you have the political factors and all that. We are basically targeting the underlying issues of malnutrition. We are looking at household food insecurity. We're looking at cultural practices that affect infant and young child feeding, or feeding of mothers and so on. Then we're also looking at food intake, Are people eating the right amounts of food? Are people processing this food in the right way that they're supposed to? So this is where we're actually coming in. And we're doing that basically with the approach of health education and behavior change communication. Um, the messages that we pass are actually different depending on the platform that we're using to pass those messages. For example, we have different media that we use to pass different messages that fit a particular target segment of women. Um, we have the audio um, um, type of multimedia where that's basically pidgin. I break down a lot of infant and child feeding practices, issues that will encourage women to actually practice, for example, exclusive breastfeeding, responsive feeding, and all other principles recommended by WHO. Then we have the videos. Those are we're going to be making how-to videos where we'll practicalize skills and demonstrate how to do some of this, either cooking or tips and all that. And then we have there's also another segment that I'm trying to create, which is also audio, where I'll be giving like that one will be in Hausa. It will be like narrating some cultural practices in the form of stories, you know, to people to understand the kind of context that we have in the northern part of the country, which affects nutrition. So we have several social media channels. We're on Twitter, we are on Instagram, and the handles are Arewa_Cafeteria. We have our Facebook, which is facebook.com/Arewa Cafeteria. And we've recently launched our channel, Arewa Cafeteria. So I hope I've been able to educate you on what Arewa Cafeteria is. Like I said, it's not a restaurant. It's a nutrition initiative. It's for all women in Nigeria. In fact, every other woman that can access. So we've had, I've had calls, I've had emails from Ghana and all that. So it's really for every woman. But it's just that, practically speaking, my passion is because of the peculiarity based on evidence that is found in northern Nigeria. I want to like physically impact directly on those women. But otherwise, every other person, every other woman is welcome to be part of Arewa Cafeteria. So thank you very much for your time, and see you again next time. Bye-bye.